My name is Gina Calderone. I am a doctor of physical therapy. I have been practicing physical therapy for 20 years, and I've taken a different approach looking at people's emotional experiences and their life experiences and how it's deposited in the physical body as physical symptoms and diagnoses and illnesses, and help them really understand how to connect back to themselves and heal the body. I definitely stepped out of the box a couple years after I was practicing in a fast-paced clinic, and I just felt like I wasn't connecting to people, and I wanted to connect on a deeper level. And I was just really curious about what they had been through, and I wanted to talk to them more, but I only had 15 minutes or 30 minutes. And then I had to give them over to an aide, and then they would take care of them in ways where I just needed more time. And the traditional physical therapy clinic system, it just wasn't serving that. So I found myself working with my Pilates clients. I was a Pilates instructor, and so I was a personal trainer basically, and started working with my clients in that fashion. And there I had an entire hour to talk to people. And I felt like I was making more progress, more connection, and helping them in a deeper way in that particular setting versus the traditional physical therapy setting. So I left the traditional physical therapy setting and went into what looked like personal training. I started a Pilates-based physical therapy studio. There was actually no name. That's what it said on the window, Pilates-based physical therapy by Gina Calderone. That's what I did. And I started listening. I started listening to my clients and just listening for years and years and years, and just listening to life's milestones and things that happen in people's lives, from birth to death to divorce to graduations, children leaving the nest, all the different things that happen in life and what it did to the body. And I just started creating a file cabinet in my mind and just started like categorizing it and just started pulling from it over the years. And I was like, oh, this person's like, they're in this pain category. Oh, they have this particular emotion going on. And oh, it's grief. Oh, it's actually sadness. Oh, they're just so much in anger. And it sits in this part of the body and it sits in this part of the body. And it just took a life of its own. So in a traditional physical therapy setting, we could take a patient with low back pain. And typically that patient has tight hamstrings, tight lower back muscles. Their abdominal muscles are not firing properly, kind of weak in that area. So they need a balancing between stretching and strengthening. And that's really kind of as far as it goes. And they can continue. They might feel better for a little while, and that's usually what happens, because those particular patients would land in my office and they're like, I went through physical therapy. I went to the chiropractor, went back to the doctor, and it's still there. It could be financial stress and something that they're not talking about, that they're harboring every single day, and they're figuring out how to make it all work, how to pay the mortgage, how to go to work, and it's just this mundane routine that they constantly are going through, and they may not be expressing it, but it looks like frustration. It looks like anger. Their significant other is like, ah, oh, they're always angry, and and that projection is spilling out. And they don't know how to stop it. And so it creates pressure in the abdomen and in the back. And this pressure needs to be released. And really what it is talking about it. It's, I'm worried. I'm scared. I'm afraid I'm going to lose everything. The two other dimensions that we need to pull into physical therapy is the emotional body and life experience, what people have gone through. And emotions, how we can connect that is really helping people understand feelings and what they are particularly feeling inside. The mind is for thoughts and the body is for feeling. So if I have a thought of some kind, my body is going to react to that and it's going to create a feeling. And if I am not conscious about it, then those feelings can start to suppress and drive harder into the body and become heavier and become these blockages that we're just disconnected from, and eventually causing pain. And our life experiences are depending on what they were, and if they're adverse from neglect and dysfunction and abuse, they can really create these lower emotions in the body, and they just become heavier and they attract more negative experience in the body, and people feel bad about themselves, and shame and guilt become oftentimes the response to many other life experiences, and they just feel like they can't get out of it. And it's literally stuck in the body and comes out through physical symptoms and most certainly just pain. It becomes a pain body. I started listening to my patients differently. And it was a key question I asked one particular patient. And I said, "When did your shoulder pain start?" And he said, "Well, when my dad died, blah, blah, blah." I didn't even hear the rest. I was just like, huh, his father died. It's probably pretty painful. It sounds painful. His voice changed. And, the heart line is here, shoulders in line with that. Major emotion of the lungs and the heart is grief. Could grief store itself in the shoulder? And I just became curious with that and started listening more and started tracking it more and using the body as a map and saying, well, okay, so, the core emotion in this area of the body is grief. It's going over in the shoulder. You're also, at the same time, you have low back pain, which could be the center of feeling, and you're not feeling, you're not really connected to your feelings. Did something happen that could cause you to shut down your feelings and cause a large amount of grief in your body? And they're like, wait, how do you know that? Yeah, it's when my dad died. Oh, when was that? 5 years ago. Is that when your pain started? Yeah. How do you know that? And that's when it all started to click. And it was just the way I presented the puzzle, like what I was just figuring out. And I'm like, this is the outcome. This is what this is showing me. So does that make sense to you? And they just couldn't deny it. And so it was just the way I approached it. And just more and more and more people were just way more forthcoming with the truth. Like, yeah. And then the body would just shift so quick after that. And then it became evident that the physical treatment and the modalities needed are what traditional physical therapy offers. Now they need the stretching of the muscles. Now they need the strengthening of the rotator cuff or the lower back muscles. Like, all that stuff now works. I just had to put that connection first. That's what was most important. The rest of the stuff was easy after that. I look at layers of trauma and how far they are away from center. It's showing me like, they're not that far. I'm looking in the health history. I don't really see that much. I've asked the questions. I don't really see that much. It's just physical. It's just like a warning sign. This is just what they got going on. This is what this is going to look like in a year, 2, 3, 4, 5 years. And they're like, feels more on the energy medicine spectrum of things, looking how emotions can cause physical symptoms to arise, but we're looking in the early years because I can now detect the patterns that will show up physically. But that's just been through experience of body after body after body and just waiting those 5 years. And then it shows up. I'm like, oh, okay. Now I got that. Okay. Because how could you be so confident to know that this pattern could lead to this diagnoses in this amount of time? And it just shows me like the pain gets bigger, it grows, there's more stuckness in the body, and it just grows and grows and grows until it becomes visible on radiological imaging or in blood work. But it's been there for a long time. And I believe it starts off in the tissues. I asked a lot of my clients when they came in with cancer or autoimmune disease, I asked them if they had physical pain first. Did you have pain? They're like, yeah, every single one of them. Pain. But we learn to deal with it. We learn to live with it. We just don't, we learn to go around it. Like, people would shift their bodies away from the pain and like come in. And I'm like, what do they got going on the right side? What's going on over there? What are they leaning away from? And as I would straighten out their spine and bring them more into that alignment, here comes the emotion. And they're really shocked by it. Like, why am I feeling these things? Why am I thinking about this thing that happened to me when I was 15? It's like, well, what was that? And then they share their body story, I call it, or their experience. And it's an instant release. The body has to release these emotions. It's extremely vital and very important to connect back to themselves. I remember at first thinking, perhaps this question is too much, it's too invasive, it's too personal. Maybe I shouldn't be asking this about their lives, their personal lives. And I don't remember, but perhaps we were taught that in PT school. I don't remember that, but it was like, I wanted to know, like, how are your relationships? What's going on in your life? What are you, is there anything that you're going through? Have you had any significant, impactful moments in your life? And most certainly people do. And I'm like, can you tell me those? Or now I just have them, listed in my intake form, and I'll go over those. I'm like, tell me about that. Tell me about that one. Tell me about that one. And I'm just really allowing them the space to share and witnessing and watching their body go through what it needs to. If I hear the voice crack or the tears start to come, I'm like, oh, allow that. That's okay. Like, allow that to come up. And I think to a physical therapist that may not understand this approach, it would probably be very uncomfortable at first because it might hit something within you. And so you might have to go through your own stuff, but then you'll get through it, and then you learn how to help others get through it too. But it really is, I found that when I started asking questions to my patients, they were grateful and thankful that I cared enough to ask more questions. And to me, they seem relieved. So I think physical therapists are just going to have to ask more questions about their lives. And if they've been in an accident, what happened in that accident? What was the outcome of it? How is your relationship with your children? How is the relationship with your parents? What is going on? How's your job? All the important things in someone's life. And if it's good, then we just check it off. Like, okay, that's okay. And then we're just looking for that one thing. And if they verbally haven't said it, perhaps it's still there in the body. But as we work on the body, it will start to reveal itself if we just stay curious. I think we have to have the desire to want to know what's going on with somebody and how I can be of help. You could ask, which I do ask, like, in what ways were you shamed or bullied in your household? And I'll just ask more questions about that. Sometimes they're very open and they'll share everything. But that's also going to sit in the gut. So are they having gut symptoms? Are they coming in with gut issues? So is this an issue with identity and my own self-power and what's going on? If there's any inkling of abuse, I have to ask the hard questions. What happened to you? And sometimes they'll say nothing, and it may not be that session, but I might ask in the next session. So perhaps something's in the area of the pelvis and it's ringing to me. There's so much pain there. Perhaps I need to outsource them to a pelvic floor PT. Like, why? Why is there so much pain here? What's the story there? So I just, with great tact, as much grace as possible. I'm just trying to ask the questions to get in there, but never has it been hard. It's never really been that difficult. People want to, they want to release it. So it's it's just in the key words that they say that they'll give you like a bit of it, and I just take that bit and go more into like if there was domestic violence in the house, like did you witness any of it? Did you see that? Did you hear it? Was it when you were sleeping? Like I couldn't sleep when I was a kid. Why? Oh, my parents argued all the time as soon as I went to bed. Huh. Okay, so that's a sensory issue. Maybe that, why? Or are they afraid to go to sleep? Was there more involved? Like, what was going on there? And so this particular patient would have the understanding of, oh, I just need to let go of that arguing in my head. It was just such a pattern every night to hear my parents argue when I went to sleep. So now I need to realize, like, I don't live in that anymore. I'm in my own home. There is no arguing. Like, oh, I can put that to rest. And now, I'll do some craniosacral therapy to help them get into their body more, close their eyes, and learn what it feels like to shut the body down in a natural, graceful, peaceful way. And then that's that.